effectiveness or are still unsure, contact your trusted healthcare provider or call the health unit for more information. Again, to book an appointment, you can go to wevax, wevax.ca, or call us at 226-773-2200 to book your appointment today. Dr. Ahmed is taking a well-deserved day off today, and so I'm pleased to introduce Ramsey D'Souza, our Manager of Epidemiology and Evaluation. Ramsey will be providing our weekly epi-summary.
Good morning, everyone, and thank you for joining us for today's presentation. So let's jump straight into our epi-summary for this week. We'll start off by looking at the COVID-19 situation around the world, followed by what's happening in Ontario, and rounding up with what is happening locally in Windsor-Essex. So around the world, cases are on the rise once again. Cases in the UK had dipped originally in the past week or so, but has increased once again. We're seeing the same in France, US, Italy, and Japan as well as in Canada too. Knowing that hospitalizations are a lagging factor, this slide looks at hospitalizations around the world per million people. We're seeing in some countries like the US and in France that hospitalizations are increasing. Likewise, this slide looks at ICU admissions, and once again, in areas like Spain, the US, and France, ICU admissions are also increasing. When we look at the proportion of cases by country that are made up of the Delta variant, in most countries it makes up a large portion of the cases, including in Canada. We did, however, see a dip in France, which I'll explain in the next slide. In the last 2 weeks, the majority of cases across the countries identified have been due to the Delta variant. For example, in the UK, it makes up 100% of the cases. In Spain, about 98%. Surprisingly, we are seeing an increase in the Gamma variant in France. In Japan, about a quarter of the cases are still due to the Alpha variant. Now moving on to Ontario. We are starting to see an uptick in cases in the province. The current 7-day average for Ontario is 375 cases a day. This has almost doubled from last week, where we were seeing about 198 cases per day on average. Now going to what's happening locally in Windsor-Essex, in our case counts of 7-day and moving average, we are seeing an increase in our cases again this week. Our current 7-day average is 23.4 cases per day. This is 3.5 times higher for this exact same time frame last week. This is just a close-up of the same figure in the last slide, but with a focus of our cases from July onwards. From late July into early August and now, we have seen an increase in our case counts. This slide captures the week-over-week incidence rate per 100,000 population, from week 17, 2020, to our most completed week, which is week 31, 2021. Our most recent completed week's rate is 30.3 cases per 100,000 population. This is a huge increase again from what we saw last week, where we were at 8.3 cases per 100,000 population. This is almost a 265% increase from last week. When we look at the last 7 days, our case rate is 37.3 cases per 100,000 population. Just like with our completed week, this is a huge increase from what we saw last week, where we were at 12.7 cases per 100,000 population. It has almost tripled from this time last week. When we compare ourselves in our case rates by week to what's happening in the Southwest and to what's happening in all of Ontario, our rates are now the highest in comparison to these regions. When we look at our wastewater surveillance data, in this slide, it's the red line. Our wastewater surveillance is showing that there has been a steady increase in COVID-19 in the past couple of weeks. This correlates with what we are seeing in our clinical data as well. This figure looks at all the tests and unique individuals tested by week in Windsor-Essex. For the week ending on August 7th, our percent positivity was 3.6%. Once again, it follows the same trend in our previous slide. It has almost tripled from where we were last week at 1.2%. For our most completed week, about 3,300 tests were completed. When we look at our most 7 days for percent positivity, we see that Windsor-Essex has the second highest percent positivity in Ontario, just behind Grey Bruce. And we are sitting at 2.5%. This is higher than last week and also higher than the provincial percent positivity, which sits at almost 2 times higher than what we're seeing right now. When we look to break this down by age group, we see a huge jump in percent positivity among those 0 to 17 years of age, and those 18 to 34 years of age. We also are starting to see an uptick as well in our 35 to 64 years of age. As it's been for a while right now, Windsor-Essex continues to have the 4th highest rate, and our cumulative rate is higher than the rate of Ontario. When we break down a case rate for the month of August, up to now, we see that the rates are higher in Windsor, Amherstburg, and LaSalle. Looking at the past 30 days by municipality, we see that 64% of our cases were from Windsor. There was a time where a few of our municipalities saw no cases, but as of now, in the past 30 days, we are seeing cases across all of our municipalities. When we focus in our last 7 days, almost 70% of our cases are from Windsor, 7% from Amherstburg, and 6% from Leamington. Here we are looking at the overall case by age and sex and what this looks like in the past 2 weeks as a comparison. In the past 2 weeks, we continue to see an increase in our 0 to 19 age group, which makes up about 24% of our cases during that time frame, alongside 32% in our 20 to 29 years of age group, and 18% in our 30 to 39-year-olds. These are also the age groups where vaccine coverage rates are lower, and in case of our 0 to 19 age group, we also have to account for those that are 0 to 11 years of age that are not also eligible to get the vaccine. Looking at our cases from August onwards in terms of how they acquired COVID-19, we see that cases have a mixed acquisition source, from community to close contact and household contacts. When we break down the source of acquisition from August onwards, approximately 37% of our cases acquired COVID-19 from the community, though we are seeing travel, close contact, and household contacts as other sources of acquisition as well. This figure looks at and compares hospitalizations in Ontario and in Windsor-Essex. In both regions, hospitalizations continue to be low, and the same trend is also followed by what we're seeing in the ICUs. ICUs in the past week in Windsor-Essex has had low to 0 cases. Now revisiting our doubling time. In Windsor-Essex, our doubling time has decreased due to a recent increase in cases over the past 2 weeks. The same can also be true for Ontario and Canada. Just to note, if the doubling time is high or trending upwards, it means that it takes longer for our cases to double, which is a good thing. But if the doubling time is low or trending downwards in this figure, it means that our cases are increasing at a faster rate. The most recent estimated median R0 is 1.63%. This is lower from last week where we were at 2.05, but it's still well above 1. Our median R0 is 1.63. When the R0 is higher than 1, each existing infection leads to more than one new infection. This signals that cases in our area are increasing, and they have been increasing for most of this month. Now moving on to our vaccine status. We'll start off by describing what's happening around the world, followed by what's happening locally in Windsor-Essex. Looking at first doses only, or at least first doses, Canada's COVID-19 coverage rate is higher compared to many of the countries around the world. Additionally, this figure also adds information tied to the continents, where we're seeing steady growth in coverage rates in Europe and South America, alongside in Asia, but coverage does remain low in Africa. When we look at second doses, we have surpassed Israel in Canada when it comes to our second dose coverage rate. We now have one of the highest coverage rates in the world. So this slide breaks down the doses administered over time in Windsor-Essex. Our second dose administration has greatly declined last month and continues to decline as well in August. In the past 7 days, 69% of the doses we've administered have been second doses, whereas last week it was about 74%. Currently, we're administering about 340 doses a day on average for first doses. This is the same as in terms of what we're seeing last week. Now this slide is similar to our last slide, but looks at all doses irrespective of if they were first dose or second dose. Currently, we are administering just over 1,100 doses a day, compared to about 1,300 doses a day to this time last week. This is once again another decrease from what we were seeing last week, which accounts for about 15% drop from last week. Further breaking this down by first and second doses, our first doses plateaued to about 340 doses per week, but our second doses has continued to decline. Currently, we're administering about 340 first doses a day, compared to about 900 or so second doses. Looking at the cumulative number of first and second doses administered, we are starting to see a plateau in residences receiving first doses, as well as those who are coming to receive second doses. Now looking at our coverage rate by age group and overall, we see that our overall coverage of at least one dose is just under 68%, and this accounts for those in all of our age groups, including those below 12. We have immunized over 78% of our adults in Windsor-Essex and 77% of our residents 12 years and older. This slide looks at the percentage coverage by age group and by week. Our coverage in our senior population 60 plus has saturated. We are seeing a plateau in all of our age groups now, where we are hoping to though increase this coverage, especially in our younger population. When we look at those who are fully vaccinated in our region, the highest group are those that are 80 years and older, with a coverage rate of 94.8%. Our 18 plus coverage rate is 71%. Here, the most important thing is to look at the spread. We are hoping to achieve 70% vaccinated coverage rate in each age band. And right now, we are struggling with some of our younger age groups, especially those below 50 years of age. Looking at the cumulative coverage rate for those that are fully vaccinated, we are once again, just like in our first dose, seeing a plateau across our age groups. We are looking to increase this number in the region to protect our community from further implications of COVID. Now, putting it all together and having a side-by-side comparison, we still have some work to do when it comes to our younger age groups with first doses and second doses. Now, looking at our hotspots and our overall coverage rate, our coverage rate for our hotspots is at 61.8% for at least having one dose. And this includes everyone in our population, including those below the age of 12. Some of our hotspots have higher coverage rates, like the N9Y, whereas the N9A postal code has the lowest coverage rate in our hotspots. And this trend continues in our second dose coverage rate as well. The N9Y has a high second dose coverage rate, whereas the N9A postal code has a low coverage rate. When we look at our cases and our vaccination coverage rate, our coverage rates have stalled, and our case counts are now increasing. So this slide compares our first dose coverage rates alongside other public health units in Ontario and the province. Our first dose coverage rate, which is found in green, is lower than the provincial average, which is the orange line, and lower than many of the other PHUs in Ontario. When we look at our second dose coverage rate, it follows the same trend as in the last slide. We're below the provincial standard and are also in the bottom half in comparison to other PHUs. So overall, the case rate in Windsor-Essex has significantly increased this past week, though our hospitalizations and ICU have remained low for COVID-19 admissions. Our first dose coverage rate for all of Windsor-Essex is up slightly to 67.7% from last week, and our second dose coverage rate is once again also slightly up to 60.6% from 59.2% this time last week. Now moving on to our monitoring indicators. For the most completed week, our weekly case rate is 30.3 cases per 100,000 population, whereas in the most recent 7 days, our case rate is 37.3 cases per 100,000 population. For the full week, our percent positivity is 3.6%, whereas in the past 7 days, it's 2.5%. Our median R not effective currently sits at 1.63. There are 2 current outbreaks that are currently active, and our first dose coverage rate is at 78.6%, whereas those that are fully vaccinated is at 71.1%, and both being for the adult age group. Thank you.
We'll now take questions from the media. We'll start with CFTV.
Good morning. My question is, with the rise in numbers of cases again, what does the data have to show before Windsor-Essex is in another lockdown?
That's a good question, actually, probably for Dr. Ahmed, who isn't joining us today. I think he spoke to this last week. We were asked, or he was asked, at what point and what types of measures would the province do if we saw increasing cases. So certainly those are conversations that are still occurring as we watch what sort of develops here, and as the medical officer of health in the health unit, if need be, localized decisions will be made. But I wouldn't have any of that information yet as it relates to lockdowns.
Okay, thank you very much.
Any questions from Blackburn?
Yes, good morning. The province has started breaking down cases in their stats based on vaccinated versus unvaccinated individuals. Do you have that ability? Do you have any plans to start breaking down the data in this way?
So I know we've been asked this question several times, and so it's great to see that the province is providing this information. I think it is valuable for people to see, the difference between those who are fully vaccinated, so that's 2 doses plus 14 days, and those who are unvaccinated, and how that relates to case increases. We do have that information, but we aren't able to share it publicly. So it is something that we're looking at. We are requesting permission. There's also some data issues related to some of that we will have to take care of. So at some point, we hope to be able to share that localized information, but right now it's only provincial.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Ramsey. Good morning, Nicole. I'm just wondering what permissions you need to seek. The Middlesex London Health Unit is sharing that local data already.
So I'll probably let Ramsey speak a little bit more to a data, as he's the person that does most of the analysis, but it is just within our agreements with the ministry. So that data is recorded in ministry systems, and the way our agreements are in place, we have access to certain information for very specific purposes. So we would have to request request permission to share it in a different way. But I'll let Ramsey expand on just some of the issues related to the data.
Thanks, Nicole. So just to echo what Nicole was saying, we do have agreements signed with the ministry, but it doesn't allow us to actually link our data sources just yet for external reporting. But there are other ways in terms of how it's done. The way we are hoping to do it is a bit more comprehensive and will improve accuracy in terms of how it's linked. So we're just waiting on getting approval from the ministry so we can do it appropriately.
Thank you for that. And I know you presented the breakdown of sources of transmission and what % of cases are coming from where. Can you expand on what we're seeing right now? Are people saying that they've attended larger gatherings, larger spreader events, or is it just more individuals contracting COVID and maybe giving it to the 1 or 2 people that they live with?
Go ahead, Ramsey.
In terms of what we're seeing, it's mixed. So with the reopening, we are seeing more people going to public settings. So whether it's restaurants, gyms, things that are open now that weren't open prior to. And with that as well, once they contract COVID, and it's been a case, in previous waves, once they bring it home, we're also seeing it then introduced into homes to people who are not vaccinated or under vaccinated in the house, and so that's how it spread. So it's a combination of both. It's bringing it back home, whether it's from different settings that people have gone to, and then it causes it to spread amongst the household and then to other close contacts.
I will just add to
And finally, I know...
Sorry, I just want to add, if that's okay, to what Ramsey has said. So certainly with opening up and people are in more settings and gatherings, but also I think we do just want to emphasize that we are, the adherence to public health measures maybe isn't as strong as it was at one point in time. So we are seeing, that adherence to public health measures, so the distancing and masking certainly is an issue as it relates to some of these cases, and so that's something we definitely want to stress, and we'll continue to stress that it's not vaccination alone that will get us through this. It's vaccination and adherence to those good public health measures that keep us all safe and keep us, whether you're vaccinated or not, limit your risk of exposure. So really, people need to continue to wear that mask, especially in an indoor setting. And especially when you're in an indoor setting, such as a restaurant, as Ramsey identified, or a public setting where, you are going to be around individuals that you don't know, and also adhering to that distancing. So that is something that we are, not seeing. We're seeing some trends related to that adherence to public health, some of those public health measures. So we just want to stress that as well.
Thank you for that, Nicole. And finally, Ramsey, having seen the data that you can't yet share publicly, can you tell us whether or not we are seeing a trend where it's predominantly unvaccinated individuals contracting COVID-19, or are you seeing something else?
It correlates well with what is shown in the province. There are more cases that are unvaccinated versus those that are. But we're hoping to provide more granular details once we have permission from the ministry.
And have you been given any indication when you may be able to share that information, or is it really just a waiting game at the moment?
Currently, right now, it is a waiting game, but we are in constant talks with the ministry, so it's just a matter of hearing back from them.
Okay, thank you.
Any questions from AM 800?
Nicole, just in regards to the vaccinations administered. So 2 weeks ago, we were at 2,100. Last week, 1,300. And Ramsey, as we mentioned, 1,100 this week. Was that expected, or are these numbers catching you and the team way off guard here?
No, I think it's been a pretty steady decline. I think we've said every week that it wasn't expected. I actually was reflecting this morning, and I reflected back to the beginning of July and some of my own comments about starting in a different role and having a really positive outlook where we were at that point. And I think we all thought we'd be much further ahead as far as the number of individuals in our community that certainly have a first dose, but definitely are fully vaccinated, given the capacity in our community and the supply. So it's not for lack of effort or individuals or opportunity. Our staff and the hospitals and all our partners, our doctors, have all been working tirelessly to ensure that residents have every opportunity, that information is out there. And so I wouldn't say from last week to this week I'm that much more surprised. I think we expected we might see a little bit of increase with getting closer to the end of the summer. School is starting. So again, we want to continue to express that urgency. We're seeing cases increase, and our cases are increasing for a number of reasons. We have lower vaccination rates than we should. It's worrisome going into a fourth wave, certainly. We need to do everything we can to prevent, a really large impact of that, as well, that adherence to public health measures. So, surprising, Rob. I think we've continued to be surprised, just given where we started. But from last week to this week, I think we continue to be hopeful that people will make the time and go get their vaccination today, because it's what's right for them and it's what's needed for our community.
Any questions from CTV?
Oh, sorry, I have one more cut out there.
Oh, sorry, Rob. Go ahead.
No problem. In regards to the case counts, obviously, since late last week, they've been increasing. I know Dr. Ahmed mentioned this last week, but this, with more things opening up, is it safe to say the health unit was anticipating an increase, but the numbers we're seeing, is that alarming, just how high they're going up? 20 last week, we're in the 40s this week. Is that a concern?
Yeah, it's a very big concern. I think watching Ramsey's presentation, I think should be concerning for everyone. To see the increase, how quickly last week, I think we were alarmed, and I know Dr. Ahmed expressed that, how we jumped, up to sort of an average of 20 cases a day, and to see 45 cases today, we expected an increase in cases given things are opening up. We're a few weeks out of that, broad opening. People are getting out there, they're enjoying their summer. We just, that 2-dose summer, I think we were, hoping we would be further along. It is alarming, and not to scare people, but I think, I am concerned, we are concerned, if this continues forward. We definitely don't want to see cases increase, and schools will be opening soon, and we want to make sure that our kids can get back into school safely. That's where they need to be to learn for their own mental health and well-being, and so let's do what we need to do to ensure that continues. So yeah, I think it is concerning to us that we're where we are at this stage, so soon after opening up.
And one final one, I believe it was Middlesex announced yesterday they're going to start administering the vaccine to individuals that are currently 11 but turning 12 later this year. Has our local health unit thought about doing something like that as well?
No. So the ministry direction is for individuals to be 12 at the time of their vaccination. That's also the direction in the product monograph for the Pfizer vaccine. So at this point in time, we're following the ministry direction. And I'll just maybe add, we're really, again, not as far as focus, we have a number of individuals that we, especially age groups, and Ramsey's presentation identified them in particular where we're seeing the highest cases right now, that 18 to 29 group, our 12 to 17-year-olds. But particularly the 18 to 29 group, we really want to focus on getting them vaccinated and getting them their first and second dose.
Thank you.
Thanks, Rob.
And any questions from CTV?
Yes, so Ontario's Medical Association is calling on mandatory vaccination for teachers. What are your thoughts on that?
For mandatory vaccination for teachers. So, Dr. Ahmed and I and the health unit, I think Dr. Ahmed has spoken to his support for policy levers related to vaccination prior. And so we continue to, talk about that. He continues to discuss and identify his support for policy levers. So I guess I'll just leave it at that we are supportive in any effort that will ensure that more individuals are fully vaccinated and protected in our community and across Ontario.
Okay, thank you. Also, do we have an update on residents who have been vaccinated out of province? I think the last time we heard was back in June. Do we have an update on that?
So I reported last week, I believe it was around, we were only around 1,500. And so I don't have an updated number. I'm not sure if putting him on the spot, if Ramsey does, as he is, again, the holder of most of our numbers. So I can turn it to him to see if he has an update.
I can speak to that briefly. So we are updating that. So you are correct, Nicole. It is 1,500. We have closer to about 2,000, just under 2,000 in total thus far in terms of our records. So we are working through that. We've almost done 80% of those. And we have another smaller batch to also upload into our system. So we are making good progress with that with our teams internally. But we were hoping that the number would be higher in terms of who has registered, because we do believe there's a higher number of residents in our community that have been vaccinated outside of our province.
Okay, also it was announced, I think it was yesterday, that there are about 20 million vaccinations that are currently in freezers across Canada. How many do we have in Windsor-Essex?
I don't have that number on hand, but we can we can provide an estimate. We can provide an estimate to the media later.
Oh, okay. And also, can you describe, are you able to describe to us basically the number of people who are getting a COVID test versus the number of people who are getting their first vaccine? Are the numbers higher for people getting a COVID test?
You mean daily, the number of people who are being tested for COVID right now versus the number of people who are being vaccinated daily?
Yeah. I know you mentioned there's about 340 people daily getting their first dose.
I don't.
Just kind of to give our viewers a sense of you know how concerning it is right now.
Yeah, I don't have actually the number offhand. I'm not sure. Again, let's turn it over to a numbers person if Ramsey does have offhand an average.
I can speak to that. So last week we had about 3,300 tests that were done, approximately, and for that same time frame, we've administered approximately about 7,000 plus minus doses, first or second. For that same time frame. So it's almost a 2 to 1, 3 to 1 ratio for tests. I wouldn't look for any kind of correlation between the two. I mean, with increase in case counts and spread in our community, you will see people who are symptomatic or are a high risk to contact that will go for testing potentially. So that will naturally increase. But our first dose coverage rate, first dose administration for the past couple of weeks has been pretty steady. It's about 340, 350 to like 380 per week. So, per day. So it's not hugely different. But with increasing case counts, we have seen an increase in testing.
Is it, are you disappointed in the public? I mean, with these daily, a lack of first doses that we're getting?
I'm not disappointed in Windsor-Essex, not at all. I think we've done, a tremendous job, and our partners have been great. Am I concerned for our community? Are we concerned for our community going into the fourth wave and where we are right now? Yes, and do we need to work harder? We've been working really hard. We are, on the ground. We are trying mobile opportunities to bring vaccination to people. So I've been very proud of this community and our residents all along through the pandemic. It is nothing any of us have ever seen before, and it's tough. Would I like to see more of our residents fully vaccinated? Absolutely. Am I disappointed where we are right now? I wish we were further along. We all wish we were a little further along for sure. But I'm, really proud of this community and proud to be a part of it. And I know everybody, this has been a long road for everybody.
Okay, thank you.
Any additional questions from CFTV?
No, thank you. Have a great weekend.
Any additional questions from Blackburn?
Yes, just one. Earlier in the pandemic, it was recommended as soon as somebody had a single symptom, they should go and get tested. As we're kind of approaching kind of cold and flu season, again, kids getting back to school, for people who are vaccinated, what is the recommendation for testing? Do you get tested with a simple, maybe sore throat or cough, or what's the recommendation there?
We'd still recommend that, any individual has a symptom, vaccinated or not, stay home, consult a medical professional, and if they have symptoms related to COVID, to seek testing. That continues to be the direction. Even if you're fully vaccinated, you can still be exposed to the to COVID-19, and as Ramsey's reported, while it's rare that individuals that are fully vaccinated will have develop the infection, they still can, and so as we're going into schools, the fall, even now, I think that message hasn't been said enough. And so I think, again, absolutely. If individuals have symptoms associated with COVID, they absolutely should be monitoring themselves and consulting with their medical provider. And, if appropriate, depending on their activities, go seek testing. And definitely, I'll just add as well, regardless of immunization status, anyone who's been exposed, so is identified as a high-risk contact of somebody, with COVID-19, the direction is, for everyone to be tested.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
Just one, but not COVID related. Nicole, were you pleased with how the online sessions, town hall sessions went this past week for the treatment sites?
Okay. Thank you for the non-COVID question. Yes, I was. I thought they were fantastic. We had quite a number of them. They were, well attended, and I thought the panelists, I couldn't thank them more. The panelists were fantastic, and I thought our community asked really great questions, and I was really pleased, very pleased. And each one was a little bit different. We'll have those recordings. I think they're already up. I can't thank our partners enough. It was a great event, and for those who are curious about consumption and treatment services and weren't able to attend, I would encourage you to watch it. It was a really, they were great events, yeah.
What's the next step now for this process?
So the next step now, as you know, we didn't just do the town halls. That was just part of the larger process for consultation. So we also had a survey. We had, I believe, more than 700 respondents to the survey. We also did key informant interviews with, businesses in the area and key stakeholders in the area. Our team is working really hard to compile all of that information into a report. We did have 2 sites that we're looking at, and so the intent of this consultation was really to get feedback from the community, those with lived experience, businesses in the area around the 2 sites, any concerns they have with either site, so that we can address any of those concerns. And then the next step after that, once we have the report, is to bring it back to our advisory committee, and we'll move towards identifying 1 site. So moving from the 2 and actually going down to 1 site. Once we've determined what that 1 site is that we'd like to move forward with, the next step after that, of course, is we'll be bringing it to our board. Obviously has been quite supportive, but we'll bring it back to the Board of Health and seek council approval from the City of Windsor for that single site before we submit our final application to Health Canada and the Ontario, the ministry.
Thank you. Have a good weekend.
Thanks, everyone.
Any additional questions from CCV?
No, thank you.
Great. Thanks, everyone.
Thanks. Have a good weekend.
Thanks. Have a good weekend.